Hello, this is Dr. Rafi Romano. I'm very delighted to present you the second movie, Joy movie, presenting the Joy bracket by a dental company from Germany. This movie will overview all the parts of the Joy bracket, starting from the features of the bracket, then advantages and limitations of the bracket, and we will finish with other information for your convenience. The Joy bracket is a very small bracket designed for anterior and premolar and molar areas. This bracket has 2 wings for the anterior teeth and 4 wings for the posterior teeth. It is prepared by CNC technology. We will discuss it in a minute. And has rectangular slot which fits until 18 wires. The wings are a little bit angulated in order to be able to ligate elastic module or metal ligature. You can see that the wire is actually floating inside the slot. It is floating in a way that when you put an elastic module, you can see from the side, if you use up to 0.16 wire, the wire actually do not touch the elastic module. So you have a minimal friction where the tooth can move freely with the alignment. When you go to more wide wires like 18 round or 16 by 22 rectangular, you have more control of the torque and more friction in order to avoid side effects that the teeth will move after they are aligned. You can see the premolar and the molar brackets. The molar bracket has more flat base to fit the molar, and the premolar has more rounded base. You can see that we have 2 wings, and this enables you to control how you want to ligate the wire. If you ligate only the mesial part, it will help you in doing rotation or sometimes avoiding rotation of the molar. We will discuss it in details when we will see case presentations. You can see here the elastic module around the tooth, and you can see here a typodont with a close-up look of the Joy bracket. You can see that although that you have here in some cases double wing, you have a very big interbracket distance. This interbracket distance, as will be discussed in details in the biomechanical lecture, enable you to get a good moment to move teeth in all direction in a very, very small amount of time, very short time. And this is very important today, especially in minor teeth movement in adults, when we want to have a maximum movement in a minimum time. Here is another close-up look of all the brackets, the double wing and the single wing brackets, and you can see both the interbracket distance and also the clearance you have on the tooth. Actually, the bracket occupy very, very minimal amount of enamel space from the tooth, which lead you to a good cleaning option and with normal cleaning skills. You don't need here a special tools in order to do the brushing because the bracket is so small that normal brushing usually clean the whole tooth in a normal way. Here is another view of a model, a typodont with the lingual Joy bracket. You can see that even in the anterior teeth, which are in the lower arch in the mandible, is very, very narrow, very, very small. We still have this interbracket distance that enable you to do bends without a lot of side effects on the neighboring teeth. The base of the joy bracket is very unique. It's made from CNC technology. The CNC technology is a technology where you can actually plan all the shape, all the grooves, all the slots, the wire, all the grabbing parts for the cement. You can plan them on the computer. You don't need to go over stages of milling, turning it into wax, then have all the remnants when you do the molding. It's all made from computer directly to machines that made all the bracket in a one piece. You can see here a closed look of the bracket base, made both for anterior and posterior brackets. And the advantage of the CNC technology is not only the highest precision, but we have also a strong gripping, a strong bonding to the tooth. I can tell you that I had very few failures with the base of the joy bracket. I had very minimum debonding of brackets. There was an article published on CNC technology comparing different brackets in the AJO-DO, and the time bracket that was used to be produced by a dental company with the CNC technology got the highest shear bond strength. So you can take it as an advantage for a small bracket to have such a strong base to hold the bracket to the enamel. The joy includes also a series of lingual wires. The lingual wires are divided into 4 different metals. The first one is the nickel titanium, which is called in Adenta Flexident. The second will be a shape memory wire, which is heat activated nickel titanium, which is called in Adenta a Thermident. Then we have the TMA or the beta titanium, or as is called in Adenta, the CNA beta 3. And this is called Trident. And the last one is a Duradent, which is stainless steel in all different sizes. Now, the wires comes in 4 sizes. The size of the wire is how much the 2 parts, the mesial and the distal parts, are open. And you can choose your wire according to the shape of the arch of the patient. Of course, with your skills, you can take any wire, 1, 2, 3, and 4, and with pliers adjust it to the arch shape of the patient. I use in my office, as you will see in one of the next lectures, in the bending wires lecture, I have a plier which is designed to bend nickel titanium, and we make all this mushroom shape arch wire bend with this plier. So I prefer to take a wire which has no preformed bends in it, because every patient is different and every stage of every patient is different, and we need to move this bend from stage to stage. So I prefer to have a wire which is flat, and I can make my bends with my plier very easily, as you will see in our next lectures. Here you can see the Adenta joy brackets bonded on a patient mouth. This patient will be reviewed in details in the case presentation lecture. The advantages of joy in a glance is a perfect and truly undetectable alternative to clear aligner. You know that it's very popular today to have 6-month smile, Invisalign, clear aligner, clear correct. All these to make with clear aligners. All this can be done very easily, very fast with a joy bracket in a very cheap and economical way, very accurate. It's a low friction when you go up to 0.16 wire. It can be done with indirect or direct bonding technique. We have a minimal but good torque control because of the rectangular slot. It's cost effective, and we have a very minimal, if any, laboratory cost, because I will teach you how you can do it in your own clinic in a very, very easy way. This is the chart of the order information. You can see you have the same bracket for the anterior, different one for premolar, and a different one for molar. The only change in the anterior is between the upper and the lower, because the lower are smaller, but some doctors, when they have a big incisors in the lower arch, they use the upper one, and vice versa. When you have a very small upper incisors, you can use the lower small brackets for the upper incisors. Here is the chart with a catalog number for every bracket, which you can choose, you can order separately or in a kit, which includes all the brackets, a kit per patient. This is just to show you a taste of cases which will be presented in our next lecture. This case was bonded. This is in bonding day. This is before, and this is 4 weeks later. Again, this is before, and this is 4 weeks later. You can see how fast is the alignment and how accurate, because of the bracket placement that was designed in an indirect way, which will be discussed in our next lectures. In summary, Joy bracket, one of the smallest brackets in the market. It has rectangular slot, which is essential for tone control. It doesn't need laboratory, but with the good laboratory tools and skilled wire bending, we can have an optimal and planned occlusion for almost every case. I want to thank you and see you in my next few lectures. Bye-bye.